infectious diseases, research, medicine, health. Welcome to Outbreak News Interviews. And now, broadcasting from the Outbreak News Skylar Studios in beautiful West Central Florida, here is your host, microbiologist and editor of OutbreakNewsToday.com, Robert Harriman.
Well, hey everybody, this is Robert and welcome to today's show. Now, Florida has reported about 1.6 million total COVID-19 cases, including more than 24,000 fatalities. And we've known for some time that some of the most vulnerable people are those ages 65 years and older. And since Florida has the second highest proportion of retirement age residents in the nation, this makes getting the COVID-19 vaccine available an imperative. Well, joining me today to give an update on how hospitals in Florida are managing to administer vaccines to the 65 and over population is Justin Senor. Justin is CEO of the Safety Net Hospital Alliance of Florida. Hey, Justin, welcome to the show.
Thanks for having me.
So well over 1 million vaccines have been administered to date in Florida, with more than half of them given to people 65 years and up. However, less than 10% have received their second dose. As recent as December, Governor Ron DeSantis issued an executive order entitled COVID-19 Vaccine Administration, Protecting Florida Seniors. Justin, can you talk about the direction of this executive order?
Sure. The executive order the governor issued came out on December the 23rd, and it was directing those involved in the vaccination process to focus on frontline healthcare workers who had direct patient contact, along with populations in the state that were 65 and older. The direction there, if you look at the numbers, when it comes to the number of people who've been hospitalized in the state, nearly 60% of the people who've been hospitalized in the state in 2020 were over the age of 65. And unfortunately, that population 65 and over accounted for in 2020 between 80 and 90% of the fatalities. So the idea is to focus on that population. So that you can sort of pull them to safety, if you will, because they were the ones who were most in danger. That included long-term care facility and staff, residents and staff. Long-term care residents, many of whom are over 65, also accounted for a really high proportion of fatalities, nearly 40%. When it comes to the healthcare workers, one of the things that we saw over the summer was that hospitals have, for example, 1,600 licensed beds, but when there's COVID rampaging through the community, the hospital staff can catch COVID in the community, and so your staff gets knocked offline, and it becomes difficult to staff all of your licensed beds. So the key concerns here were we didn't want to overwhelm our healthcare system. We wanted to make sure that nothing would overwhelm it so that all of the staff would be available in the event of a COVID surge. And then also at the same time, we wanted to vaccinate people, and we want to vaccinate people who are most likely to be hospitalized if they were to contract COVID. So you want to pull those populations to safety. Ultimately, that puts the state in a position, hopefully by sometime in early March, earlier if the supplies start to increase, but in a position where the people that are most likely to be hospitalized have been pulled to safety, and the frontline healthcare workers are not in any danger of being knocked offline, so that any surge that does come will be fully staffed and prepared to handle.
Yeah. Now, the Florida hospitals have partnered with the state to administer the vaccines. Justin, how have they dealt with this task of administering the vaccines to this most vulnerable population?
You know, it's very localized. So the hospitals are in tune with what the local population needs and where they can best reach that population. So it depends on where you are. In some instances, they've set up outposts at community centers or at churches. Sometimes they've done it in conjunction with county health departments. But the hospitals do have the expertise, and they have the staff who can administer the vaccine, and they've played a very important role in it. Overall, they've been able to build capacity to the point very quickly where the hospitals are capable of doing 20,000 plus vaccinations per day, and could pretty easily ramp up to 40,000 or 45,000 over a 7 to 10 day period. So 40 to 45,000 a day if the supply is there and if we're needed.
Yeah, I'm in Hillsborough County, and I know if you check the county website, vaccine appointments are full due to the lack of vaccines. Are hospitals able to keep stocked with vaccines?
You know, the real issues here, I think there's been a lot of planning and there's been a lot of capacity building, but right now the issue is supply. The supply from the manufacturer is not there right now to actually fully stock the capacity. So no, I mean, hospitals have some vaccine and they have been able to get second doses to make sure that they can get a second dose to anyone that received a first. But it's going to be there's not a lot of hospitals around the state that have a lot of vaccine on hand to deliver first doses right now. Ultimately, we're not all of the capacity. Walgreens and CVS are playing an important role here, and Publix is playing an increasingly important role. Right. So there are a lot of different avenues that you could use to potentially get the vaccine.
Yeah. So where do you see this progressing, say, in a week, in a month?
Hopefully there's a dramatic increase in the supply to all of the states, including the state of Florida. I think that's the key. We have been able to ramp up. I think in the last 10 days of December, the state of Florida delivered about 250,000 doses. And they were all first doses, obviously. In the first 10 days of January, that went up to maybe about 300,000 plus. And I think in the most recent 10 days, it's going to be a number over 400,000. So it is slowly creeping up. But it would be nice if we could get to a point where we are delivering upwards of 500,000 first doses a week or second doses, right, a week to try to get through this as quickly as possible and pull these populations to safety as quickly as possible. I think that one other thing that might happen here in the next 90 to 100 days is we may see one or even possibly two new vaccines come out, and so that could dramatically increase the supply. One is from AstraZeneca, and one is from Johnson & Johnson, and they're in pretty late stages of the trial and approval process, and they are both one shot as opposed to two. And they might not be, we'll have to wait and see whether they are just as effective as the Pfizer and Moderna vaccines or less effective. But certainly if they are very effective and it's one shot, that would improve some of the logistics. It's very logistically difficult to give two shots.
Sure. Okay, well, let me go ahead and close out with this. I want to go ahead and give you the chance to talk about the Safety Net Hospital Alliance of Florida and the work that you do.
Sure. We're a group of hospitals that work together to help fund graduate medical education in the state of Florida and also to serve both low-income populations, the Medicaid population, and the uninsured in the state of Florida. It's 14 systems. Our members are children's hospitals, academic medical centers, teaching hospitals, and public hospitals, as well as something called a regional perinatal intensive care center hospital. Those are the categories of our membership. Our members run from Pensacola all the way down to Miami, and we serve the population of Florida and the state of Florida. Patients are welcome regardless of their ability to pay.
Excellent. Great news, great work. And I want to thank you, Justin Senor, for sharing your time and your expertise. Thank you, sir.
Thanks for having me.